Have you ever wondered what it would be like to experience the world through multiple identities? It's a fascinating question that leads us to the intricate world of dissociative identity disorder. This complex psychological condition manifests when a person has not just one but two or more distinct identities or personality states. Each identity has its own unique perception, interaction, and understanding of the world. Intrigued? Let's delve into the mysterious world of DID and understand it better. Dissociative identity disorder, formerly known as multiple personality disorder, is a fascinating yet complex phenomenon. It's characterized by the presence of two or more distinct identities within a single individual, each with its own perception of the environment and self. But it's much more than just a shifting of personalities. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or DSM5 TR, defines several symptoms of DID. One of the most telling is the frequent gaps in the recall of everyday events, personal information, or traumatic experiences that are far too extensive to be explained by ordinary forgetfulness. These memory gaps can be incredibly disruptive, leading to confusion and a sense of disorientation. In addition to these memory gaps, individuals with DID often grapple with various mental health issues. Depression, anxiety, and suicidal thoughts are commonly experienced. These symptoms can be overwhelming, creating a whirlwind of emotions that are difficult to understand and manage. The presence of two or more distinct identities, or alters, is another core symptom. Each alter may have its own name, personal history, and characteristics, including differences in voice, gender, mannerisms, and even physical qualities such as allergies, right or left-handedness, or the need for prescription eyewear. It's important to note that these identities recurrently take control of the individual's behavior, which is often a source of distress and can interfere with normal functioning. It's also worth noting that DID is not a form of schizophrenia, nor is it a result of drug abuse or a general medical condition. It's a distinct disorder, often misunderstood and misrepresented, which can make diagnosis and treatment challenging. The causes of DID are equally complex and multifaceted. Opening. The exact causes of dissociative identity disorder, often abbreviated as DID, are still unknown, but they are frequently tied to extreme stress and traumatic experiences. Now let's delve into this a bit further. The human mind is an incredibly resilient and adaptive system. When exposed to extreme stress or trauma, particularly during the formative years of childhood, it has the ability to dissociate or separate from reality. This can be seen as a protective mechanism, allowing the individual to escape from the distressing situation at hand. In the context of DID, severe psychological trauma during early childhood is often a common thread. This trauma is typically extreme, repetitive physical, sexual, or emotional abuse. The child's mind, unable to cope with the unrelenting horror of their reality, starts to compartmentalize these traumatic experiences. These compartments, or alters, can then develop into distinct identities, each with its own characteristics, memories, and ways of interacting with the world. The development of these multiple identities is believed to be a sophisticated survival strategy. It's as if the child's mind is saying, if I can't escape this situation physically, then at least I can escape mentally. By creating different identities, the child can distance themselves from the trauma, with different identities taking over during instances of abuse. It's important to note, however, that not everyone who experiences childhood trauma will develop DID. There are likely other factors at play, such as genetic predisposition or the lack of a supportive or comforting figure during these traumatic events. In essence, DID is likely the result of a complex interplay of environmental, biological, and psychological factors. We also need to remember that the trauma often associated with DID is not limited to childhood. Adults can also develop this disorder following traumatic events, though it's less common. Closing. Though this condition may seem overwhelming, there are several treatment options available. We will explore these treatments in the next section, shedding light on the hope and healing possible for individuals living with dissociative identity disorder. Treating DID can be challenging, but it's not impossible. There are several therapy options that have proved effective. Let's start with psychotherapy, often the first line of treatment for dissociative identity disorder. This is a broad term encompassing various therapeutic techniques, but the primary goal is to help patients integrate their multiple identities into a cohesive self. A crucial aspect of psychotherapy involves building a trusting relationship between the patient and the therapist, which facilitates open communication and helps the patient navigate their complex emotional landscape. Next, we have cognitive behavioral therapy, or CBT for short. This approach focuses on helping individuals with DID understand and change thought patterns that lead to maladaptive behaviors. It's about identifying the cognitive distortions or faulty thinking that may contribute to the maintenance of dissociative symptoms. By tackling these distortions, individuals can start to gain control over their symptoms and manage them more effectively. Family therapy is another essential tool in the treatment of DID. It's no secret that our families play a significant role in our lives and our mental health. In family therapy, the focus is on improving communication within the family and educating family members about DID. This helps create a supportive environment for the individual with DID, which can be instrumental in their recovery. Then there are creative therapies such as art therapy or music therapy. These offer a non-verbal outlet for individuals to express their thoughts and feelings. For someone with DID, who may have experienced traumatic events that are difficult to put into words, these therapies can be incredibly beneficial. They allow for the exploration and expression of emotions associated with different identities, which can aid in the integration process. Lastly, we can't forget about medication. While there's no specific drug to treat DID, medication can be used to manage any co-occurring conditions like depression, anxiety, or sleep disorders. It's important to remember that medication should be used in conjunction with therapy, not as a standalone treatment. Remember, treating DD isn't a one-size-fits-all approach. It's about finding the right combination of therapies that will work best for each individual. And it's not a quick fix either. Treatment can be a long journey, often requiring patience and perseverance, but with the right treatment plan and support system, it's a journey worth taking. It's also crucial to keep in mind that treatment doesn't necessarily mean curing DID. The goal isn't to eliminate the different identities, but to help the individual gain control over their switching and improve their overall functioning. It's about helping them lead a fulfilling, productive life despite their disorder. With the right treatment and support, individuals with DID can lead fulfilling lives. Let's look at some real-life examples to better understand how these treatments work. Consider the story of Jane. Jane was diagnosed with dissociative identity disorder when she was in her early 20s. She had a history of trauma and struggled with memory gaps and sudden changes in her behavior. She felt as though she was living her life through a fog. After her diagnosis, Jane began a combination treatment of psychotherapy and cognitive behavioral therapy. Over time, she learned to recognize when she was switching between her identities. She gained control over her symptoms, leading to a significant improvement in her quality of life. Jane is now in her late 30s, and while she still attends therapy, she has a fulfilling job and a stable relationship. Then we have the case of David. David was diagnosed with dissociative identity disorder in his mid-30s. Like Jane, David experienced memory gaps and changes in behavior, but he also struggled with severe depression. After his diagnosis, David entered a treatment program that included medication for his depression, talk therapy, and eye movement desensitization and reprocessing, EMDR, for his trauma. Today, David is managing his symptoms effectively. He has learned to cope with his past traumas and is working towards a healthier future. Lastly, let's talk about Sarah. Sarah was diagnosed with dissociative identity disorder as a teenager after years of struggling with confusion, memory loss, and a feeling of being out of touch with herself. She underwent a comprehensive treatment plan including psychotherapy, EMDR, and art therapy. Art therapy in particular has been an instrumental part of Sarah's healing journey. It has helped her express her feelings and experiences in a safe and therapeutic way. Today, Sarah is in her early 20s and is studying to become an art therapist herself, hoping to help others who are facing similar challenges. These examples highlight the importance of personalized treatment plans for those with dissociative identity disorder. Each individual's experience with DID is unique, and so too should be their treatment. Some may find success with medication, others with therapy, and others still with alternative treatments such as art therapy or EMDR. The key is finding what works best for the individual. These stories also show us that a diagnosis of dissociative identity disorder is not the end of the world. With the right treatment and support, individuals with DID can lead fulfilling and meaningful lives. They can manage their symptoms, gain control over their identities, and even use their experiences to help others. It is not an easy journey, and it requires patience, understanding, and a lot of hard work. But as Jane, David, and Sarah's stories show, it is a journey that can lead to healing, growth, and a better understanding of oneself. These stories are a testament to the fact that with the right help, it is possible to manage and even overcome DID. Dissociative identity disorder is indeed a complex condition, but it's not unbeatable. It's a psychological phenomenon that's more than just a collection of symptoms. It's a testament to human resilience, a coping mechanism that the mind employs when faced with extreme stress or trauma. Throughout this exploration, we've delved into the intricate world of DID, discussed its causes rooted in early traumatic experiences, and highlighted the various treatment options available from psychotherapy to medication. We've also walked in the shoes of real people living with DID, hopefully offering you a glimpse into their daily experiences. It's crucial to remember that understanding and empathy play a vital role in supporting individuals with DID. Like any other health condition, it should not be a source of stigma or discrimination. It's about acknowledging the strength it takes to navigate the world with an often misunderstood condition. So, let's keep the conversation going. Let's strive to create an environment where mental health is discussed openly, where individuals feel safe to seek help, and where everyone is treated with kindness and respect. And remember, knowledge is power. The more we understand about conditions like DID, the better equipped we are to support those who live with them. If you found this video helpful, please like, share, and subscribe to our channel for more insightful videos. Thank you for watching.